Hi,
In the
everyone.
laptop.
Hi. Hi.
So, you know Lena?
Yes, hi, Lena.
Is Monica?
Say louder so everyone can hear. Can you say that again, louder, Augusto, so that when people are watching the video, they can hear you introduce?
So this is Lena.
Hi.
Hi.
Monica.
Hi.
Hi, Monica.
Maria Sole.
Morning.
Maria Sole, hi.
She comes from Italy, from Bologna, in fact. And
Nice.
Gabby.
Hi.
Hi, Gabby.
So, and we have other people in the lab that could not join us, but as you know, we've been quite we're very invested and dedicated to CDH research in various forms and shapes.
Yeah, you're doing tremendous work. You publish more papers than anyone I know. It's wonderful.
There's more to come. There's something that is very, very interesting that is under review. Second round, we had only minor comments, but we have 3 papers out that we hope to get out soon. We're doing definitely the biggest effort in the lab is trying to find a stem cell based therapy for hypoplastic lungs, so babies with CDH. So that's what we would like to, what we are actually working on the most is really to regenerate these lungs. And we're having very, very promising data still at an experimental level, but hopefully we're gonna speed up. We are actually now we have quite a network of collaborators around the world, including the US, Brazil, the UK, Europe in general, the different countries. So, so that's our main focus. What we actually wanted really to look into more was also certain populations of babies with CDH, such as the ones who are unfortunately born with a cardiac anomaly, congenital heart defect. And so we looked into that, and we published on that. We looked into babies that unfortunately on top of CDH have some neurodevelopmental delay for various reasons, which means, for instance, even just hearing loss. It's been very well reported, but we looked into various aspects of the neurological follow-up of these babies. Because we think that with that there will be more awareness and hopefully more support from the various institutions. And recently, actually, we have sent an abstract, but we looked at, this is what Monica has done, looked geographically around the world, the incidence of CDH. And what we were very shocked by was the fact that there are a lot of countries, also Western world countries, that have never published their data. So we really don't know. And it's not just a matter of the incidence or the prevalence of the disease in the various countries, but it's what the prognostic factors, or sorry, the predictive factors for CDH. It would be very interesting to know what causes CDH. And we realized that on the world map, there's like huge zones that are completely unexplored. Typically, we think that's in developing countries. And there's a lot of work coming from the US, a lot of work coming from Europe, but there's pretty much nothing from Canada, for instance. And so we are then embarking on a bigger project that is quite expensive in terms of time and money, and we want to actually map out all the various provinces and see whether there is a difference in the prevalence of CDH in, for instance, the Aboriginal populations, or specific maternal age groups. Canada is really a melting pot. We've got any ethnic background that you can think of, and it would be very interesting to see whether we can see a trend in the various provinces, various zones of the country, whether there is a different prevalence of the disease, and try to track back why this has happened.
Does Canada their healthcare system currently record all birth defects? And
They
how will
do.
you pull that
They
data?
do. They do. But nobody has interrogated the system. You're going to be the
Oh, I
first one.
see.
So what we do, we have a very good system of recording data on babies that have been operated on. And of course, that's a tremendous amount of work that's come out of CAPSNet, so under the auspices of the Canadian Association of Pediatric Surgeons, is something that has been really very important for us. But still, we don't know. We don't have a denominator. We don't know how many babies are born with CDH in the various provinces, unless, of course, then they went on to be operated on, and of course but that's you have a very selected population of babies with CDH. And the other thing is we don't know the factors that could be causative of CDH with the CAPSNet database. And that's why we are reaching out to the ministry and getting actual information. There's a lot of paperwork to do, and it's time consuming, but really adamant to know more.
Yeah, that would be very beneficial to have that data, and hopefully we can do something like that in the U.S. and other countries as well. I know in the U.S. it's been a big struggle to get a database of all birth defects, the diagnosis, the outcomes, and how many are aborted as well. So I mean, with terminations, we really don't know the exact occurrence rate because so many families elect to terminate, and it would be nice to have all that information to know the exact prevalence, which I know everyone's still struggling with that. But so, well, we have you guys here on the telethon. Let's talk about the joint project that we're going to be doing to work with older survivors. So I'll let you start that.
Yes, and this is what it's really the most recent addition to the list of the various aspects of CDH that we are actually interested in. There are some studies, for instance, from Finland, looking at the long-term follow-up of adult patients who have survived CDH, born with CDH and have survived. And unfortunately, there's not really much about the quality of life. So, and also these studies are, of course, limited by a small number of people, a small population, due to the fact that there were single institution studies. And so that's why we had this idea. We reached out to you, Dawn, and we hope with the help of such a huge family association like yours, we can understand better. The question is really, what is the quality of life for somebody who is a young adult or an adult who survived CDH? Do they do as well as the general population, or instead do they have more issues? For instance, I can imagine heartburn. Is the incidence of heartburn the same or not? But in general, what is their quality of life? And we're really interested in knowing that because, again, it's not just an academic question, but we think that with more awareness, we will get also more support. So what typically happens now is that we follow up very religiously our patients until they are 18 years of age. We try to transition them to adult physicians, but in the adult world, it's not their fault, but the adult surgeons do not know much about CDH. They would call us to operate on somebody who has a late diagnosis. The physicians also, they don't know much about CDH because, of course, they may have encountered one or two patients in their whole career. And so, but if these patients do well, that's okay. But if instead these patients keep having troubles, and so then I think it's really important to understand what kind of issues they have and what kind of support we can provide.
Oh, we're really excited about this. That's one of the biggest questions we get asked when a family is diagnosed is, what is the future going to be like for my child? And that's something we can't answer, and it's something we can barely even guess at now. So having that data will be very, very helpful. We do have a large number of older survivors, and by the time everyone sees this tape next week, uh, a large number of people will have gotten emails from us giving them a link to log into the survey, answer one-page questions that will help with the research at the University of Toronto and help us get some answers, not just for survivors to compare what everyone's going through, but to give some hope and information to the next generation of CDH survivors as well. And the questionnaire is very, very simple. It will take you maybe 15, 20 minutes at the max, more like 5 or 10 minutes to answer the questions. And if you have any problems, me or Rachel or Tracy will be happy to help you log in. But everyone who qualifies to be a part of this study will have gotten an email from us. If you did not, please let us know.
Yeah, that's very important.
There...
Sorry, Don. What I can tell you from a practical standpoint, what I face as a pediatric surgeon, we do have some pediatricians in the community that have an interest, a specific interest in babies with CDH, and there are maybe pediatric respirologists, but they are in the community. And what I envisage for the future is that there will be physicians that have also an expertise, and we can send our adult patients too, because they they know about CDH, they know which kind of patients they would have in front of them and which kind of troubles that we're going through. And this is why it's very important. I think your work and the work of the whole association is amazing in raising awareness. We had a meeting just yesterday with some collaborators from the UK, specifically one person who doesn't come from the medical world, and they were shocked to see that at least in Canada, the number of cases of CDH babies that are born every year is double the number of new diagnoses for spina bifida and cystic fibrosis. They couldn't believe it. They knew about CDH, obviously, but they thought it's such a rare disease. And when you talk with the people, lay people, people in the streets, have heard about spina bifida, they've heard about cystic fibrosis. And so I think it's very important that people know also about CDH. It's important because we need more support, more help from the community. And so what you're doing every year with this, with all the initiatives, in fact, at different levels is really tremendous. It's really important. It's crucial.
Thank you. I have 2 questions for you. The first is, I know all the parents are going to ask this, the ones who are participating in this study. Do you have any idea how long it will be before they will see something published, or they will be able to access information to what you find out from the study?
So I can tell you that there's different ways of doing surveys. I've been doing surveys for various organizations, for instance, for the European Pediatric Surgical Association for a number of years, for more than 10 years. And so I studied really the science behind surveys and questionnaires. And so we want to do it as good as possible in a way that it can be really, it is already a validated questionnaire, what we use, but also we need to capture a good number of responders, because otherwise the answers would be meaningless, obviously. We want also to match that, and we will administer the questionnaire to normal people, normal controls, that will then make us understand whether really there is a difference between the general population and the population of CDH survivors. So to do all this, it all depends on how much people actually are engaging with the survey and how many survivors are actually replying. And the sooner, the better. Then I have an army of people that will analyze the survey and work on it And so I think that the idea would be to present it at one of the international conferences, share the data with the CDH families, with families of babies with CDH or survivors with CDH, and we will publish it no later than 2020.
Wonderful. My question is, are we going to see the lab again when the CN Tower lights up for us?
For sure. We absolutely, you know how much we are engaged, and I know there's again the event at with the Blue Jays here in Toronto, so definitely we will join.
Wonderful. Well, I so enjoyed meeting all of you last year. I am very disappointed I can't be in Toronto this year, but I know the families will be very happy to see you. And so thank you so much. Is there anything else you would like to add before the telethon interview ends?
No, I think thanks again for giving us the opportunity to also spread the news that we exist. There's definitely people doing research from basic science research to translational research, clinical outcome research on CDH, also in Canada. There's a few other investigators that are interested, but definitely we need more. And we need the people know that we're really so much dedicated. There's people, as I've shown you here, and this is a small representation of the lab. There's people coming from across the world. We have people from Europe. We have somebody that is coming soon from Hong Kong. So it's really trying to drag as much forces from all over to have really to get closer to an answer. The answer would be, of course, why this happens, and especially how we can treat it in a way that the survival goes up. I really believe in the theory of marginal gains, so little by little, every year, and with the effort of everyone, we can definitely make it. But it's the awareness that really lacks, and this is where we need to really work. So thanks again for inviting us, and we're always here if there is any question from parents of kids with CDH or CDH survivors that want to either come and visit the hospital or the labs, or just they have questions. Very, very happy to answer and to take them around.
Thank you very, very much, all of you. It's wonderful seeing you again. I hope to see you soon. I'm sure I will on the conference rounds. And thank you for all that you do for all of our children. It is so.
And sorry, I just remembered, Dawn, last year I showed you this, but you know, we have a SickKids campaign, which is the Versus campaign. And we have, you know, the T-shirts of SickKids versus CDH. This is an initiative that it's actually doing very well from a marketing point of view for the hospital, but for us, again, it's to raise awareness. That's the most important thing. We want people to know that CDH exists, that we still lacking a lot of answers, and we need more support to get to these answers.
Absolutely, and I love the shirts, and I need to order one from you guys actually, so I'll make sure I do that.
One when we see each other next.
Yeah. Well, thank you all, and we're going to say goodbye to all of the viewers now, and we'll see you soon.
Bye, Dawn. Thank you. Bye.